Okay, so who are we? The Center for Research on Work Disability Policy. So in 2012, the Center for Research on Work Disability Policy, and we use the acronym, and people struggle with it, CRWDP, but it's easier to say if you practice. See, I do this Malcolm in the middle, CRWDP, and it gets to you after a while. Okay, it was created through a SSHRC funding envelope that's for 7 years. So we're into our third year right now, which ends in the spring of 2016. So we have another 4 to 5 years going forward. It took quite a bit of time to develop it. So Ellen and I had a 2-year development process where we were contacting all kinds of people across Canada, partners and stakeholders and academics to really get us together. So that was a big effort prior to actually receiving the funding from SSHRC. We're a national collaborative, so we have people here today, in fact, from across the country. Quite a number of us are involved directly in this initiative. We have over 60 academics involved in this initiative and over 60 partner organizations and about 15 research institutions. So it's quite a large collaborative, and we keep growing, and I'm just losing track of all the people involved in it, which is maybe a good sign. I'm not sure what the maximum capacity is, but it's exciting to see that people are really interested in joining and being part of this collaborative. We're dedicated to addressing issues related to Canada's work disability policy system. And on this PowerPoint, you can see that there's a map of Canada, and we have 4 centers across the country which have an executive that's involved with getting people together in those local jurisdictions in British Columbia, Ontario, Quebec, and Newfoundland. That's just out of convenience having those 4. We couldn't imagine trying to manage 10 clusters at this time, but we do have people involved from across the country. It's not exclusively about just those 4 provinces. So definitely these issues pertain to all Canadians across the entire country. And we do speak to those kinds of issues, but we realize the need to think about local differences as well. In Newfoundland and Quebec and British Columbia, that some of the issues are provincial and local, and we want to make sure we address those kinds of issues as well. Our mission is that we are a transdisciplinary initiative. So we have people from various parts of the disability policy system, academics from different disciplinary backgrounds coming together to work together on this very complex issue of work disability policy. So what we want to do is think about the future of work disability policy in Canada. Our mission is to conduct partnered research on how to improve Canadian work disability policy so that all people can access employment and income security. And our core mandate also includes bringing all the varied stakeholders together. And as you can imagine, work disability policy is a very complex area and many different stakeholders from different parts of the system. But we also want to include employers in this too. They're a key player as well. So we're not thinking just about program partners. We're not just thinking about community. We're also thinking about employers being key parts of the work disability policy system. We want to identify issues associated with program coordination and complexity. We're going to speak a little bit about that in the morning and some work we've been doing, but thinking about the various layers of the programs and supports that are provided at the provincial and federal level, and how we can do a better job of coordinating those programs and supports. We want to facilitate dialogue, problem identification, and ultimately, obviously, policy action. We want to support transdisciplinary research projects, including international comparative work. So it's really critical for us to look abroad to see what other good examples we can find in other countries, to see what we can bring to Canada possibly, to think about how we can do a better job. When we look across the provinces, they're doing different things, but some of it's very similar. So we need to think more broadly, see what other jurisdictions are doing and what's innovative and different that might work here in Canada. We want to build capacity for doing this kinds of research on applied work disability policy. That's a really key part of our SSHRC initiative, is building the capacity to do this and sustain this kinds of research well into the future. And ultimately, and it's the theme of our symposium today, is we want to build a roadmap for work disability policy in Canada. Just a little bit about how we are structured. We have a governance structure that involves all of the partners as well. We have an external advisory committee. These are international experts in this field. Some of them are academics, some of them are policymakers, but they come together to give us long-term guidance on the work that we do. We have an executive committee who comes together 4 times a year to discuss, some of the current and pressing issues that we need to grapple with in the clusters and across Canada. And then there's our funding organizations. Our national office is based here in Toronto, so we have some support services here in Toronto to help with the administration, like organizing this kind of conference. And then we have a number of oversight committees, so doing various things such as knowledge mobilization, partner engagement, seed grant funding, and student capacity building. So work disability policy, what are some of the issues and context? As you can imagine, the Canadian system is quite complex. We're a federation, so we have provincial level programs, we have some municipal supports as well, and then we have federal level programs. So it's a multi-layered system that can be difficult for many people to navigate when they're looking for support. Coupled with things like changing nature of work and work injuries, and these are posing new challenges for people who are confronted with disability over the course of their lives. So that's a new layer that we really have to think about going forward. The nature of work is changing quite a bit. When you think about how labor is contracted these days, it's often precarious, short-term contracts, temping agencies, working from various locations. How does that fit into the picture of the supports that are provided in our disability policy system? Also, we have to think about the economic climate. Oftentimes, when we have downturns or the growth is not as much as we'd like to see in the Canadian economy, there's a reaction to try to narrow eligibility and restrict eligibility in order to make sure that the resources are adequate. But sometimes that's counterproductive, because ultimately that further makes it difficult for people in these situations to find the support and engage more actively in the labor market. So we have to think about how we react in different parts of the business cycle in a way that's supportive and productive and helps people continue their engagement. Here's a graph that gives some picture of some of the demographic changes that I alluded to earlier. The changing nature of work, workers, and injuries. As we all know, the labor force is aging. You can see that upward growth of people 55 years and over who are employed in the labor market. As you can imagine, when you think about what that means, as we get older, it's very common for chronic and episodic conditions to affect us. How can we continue that engagement? There's an expectation for people to stay in the labor market longer, so we really need to think about what kinds of supports do older people need who have chronic and episodic disabilities and want to continue their engagement in the labor market. Concurrently, as you can see, also younger people are in the labor market are declining in numbers in relative proportion, and this is over a very short period of time actually, so these trends are long-term trends, and we can even see them in short periods of time. In this chart, we can see that there's changes in the nature of contracting, as I mentioned. So temporary and contract work is on the rise in a lot of industries. Really, the growth rate here is really incredible in some sectors in particular. So how do we grapple with that when people have disabilities, short or long term, and need to continue their engagement in the labor market, and the only kinds of work that's available is these precarious employment opportunities. In this graph, we just give you a sense of the complexity of the program supports that are available at the provincial and federal level. There's at least 8 or 9 different programs that people can access concurrently or consecutively. And navigating the maze of these programs can be horrendous. The eligibility requirements vary, the definitions of disability vary, and who's eligible in terms of contributions or didn't contribute can determine whether you can access some programs or not. So that is a really big issue, and that's really one of the themes that we're going to be talking about today is coordination and navigability of our disability policy system. Definitions of disability also vary from program to program. There's a medical model that focuses on the individual. So does a person have an impairment, and they focus only on that individual characteristics of their health conditions and don't think about the context. There's also a socio-medical model that looks at the individual but also looks at the context, and many workers' compensation systems focus on this kind of a definition of work disability. They often think about loss of earnings capacity, and they do assessments of loss of earnings capacity in a lot of the workers' compensation programs here in Canada. And then we look at another model that's very popular amongst disability rights activists, the human rights model, which focuses on context and thinks about how can we make sure that our society is inclusive of everybody. It's really the context that makes the difference. We should start off at the societal level and think about how can we create a world of both social and built environments that is inclusive of everybody and doesn't focus on the individual but starts at the societal level. And often the disability rights movement, it focuses on that model of disability. When we think about how our systems are organized, they're also very siloed. The work injury system, as I mentioned, focuses on a medical model, sometimes a medical social legal model, and then the social security system focusing on the broader human rights type models, and sometimes also the medical model. They're very siloed, and in our efforts to bring this center together, we wanted to make sure we could bring all of these different groups together. The academics that are working in these different silos, the community partners and other partners that are working in these different silos, so that we work together, because it's only going to work if we bring all of the different groups together and to the same table to discuss how we can change disability policy for the future of Canada in order to ensure that everybody's included in the labor market when they want to and can work, and that it's a more inclusive society. Our population health focus really tries to frame it as something that affects all of us at some point in our lives. And that's really the case. You know, as I mentioned, as we age, chronic and episodic disabilities are often a common factor of the aging process. So it touches all of us at some point. It's not a fringe concern. People with disabilities actually represent 15.5% of Ontarians, and probably the same proportion in other provinces as well. But when you think about our families and our community, it touches about 50% of all Canadians in some way, directly or indirectly. So the CRWDP's overall objectives and research question is to identify how people, when disabled, can better be retained and integrated into the Canadian labour market. We have three overarching research questions that are kind of encapsulating the kinds of issues we want to deal with over the 7 years of our initiative. The first is, how well does the Canadian disability policy system serve current and emerging needs of working age individuals when disabled in terms of employment and supports and opportunities? And for what individuals and labour market context does it work well, and when doesn't it work well, and why? And what are the key opportunities for policy and program improvement over the short and long run? In terms of our research activities, we have three broad themes that we try to package our research activities under. One of them is a population theme, a population analysis type issue, so trying to describe the current labour market context and the people involved in it. The second theme focuses on the labour market issues and that we're grappling with today. And the third is about law, policy, and program analysis. Highlights include requirements of partner involvement in all of our projects, so we really make sure that, because we're a partnership initiative, that partners are included in all aspects of the work that we do, including the research and the governance. We're emphasizing transdisciplinary research methods. We're also funding for a number of research projects, 4 large ones, and we're also providing seed funds for a number of smaller studies to leverage them to hopefully they'll become larger projects through other funding resources. And we're also including a substantial amount of student funding to support both doctoral work, postdoctoral work, and active engagement in all the research projects. In terms of some groundwork studies that we've been doing as a sort of the foundation pieces that we wanted to make sure we had in place for this initiative, we've done an environmental scan of past policy initiatives that are addressing work disability policy system coordination issues. That's a mouthful. This is a resource that we put on our website that has identified all of the past efforts of the sort that we've done to try to think about how we can do a better job of coordination and navigability. We knew we weren't the first people to do that, but so we want to know what else has been done in the past and what lessons can we learn from those past experiences and efforts. And we've put all of that those resources, the reports, the documents, and related materials on our website. So please do check it out. It's crwdp.ca. And we've also done a scoping review of work disability policy. This is an international literature review where we've identified 750 scientific articles about work disability policy, where we've classified them into different categories, organized them by different types of programs and issues being addressed. And that's also available on our website. We try to put as much as we can of these resources to make it publicly available through our website. And I'll leave now for this part for Ellen to take over.